Hello everyone, Dan from Tide Wellness here. Today we are going to go over how to self-administer a subcutaneous injection. It's a question I get a lot from new clients who have never done this before. It's not really hard, it's pretty straightforward, but there are a couple steps involved. So hopefully by doing this video, it'll help alleviate some concerns and hopefully give you some instruction on how to appropriately administer the medication. So first things first, you're going to wash your hands, obviously, to help reduce the risk of infection. You're going to gather your supplies, which is the needle or the delivery device. You have the medication, and then you have alcohol wipes, both to clean the vial and then also to clean the area you are going to inject. So we have our syringe. This is typically what I get from the pharmacy, so this is what you can expect when you get your package. It is a 1 cc syringe or 100 unit syringe. So when you get your medication, it's going to tell you to draw up a certain amount of units. Whatever unit it tells you to draw up, say if it's 10, 15, say it's 20 units. If it's 20 units, you're going to draw up to the number 20, okay? Now, we also have our vial of medication. The vial is going to come with a top, which you can usually pop off. You're going to see a metal ring with rubber in the middle. You want to aim the needle for the middle of that rubber. That's going to make it easiest to withdraw the medication. Then lastly, of course, we have our alcohol wipes. So you're going to start by cleaning the vial so it's nice and clean. Just rub the alcohol pad on there. I have 20 units I need to draw up. That's what my prescription says. So I'm going to take the little orange piece off the back that exposes our plunger. I'm going to bring this down to the number 20. Hopefully you can see that. That's 20 units of air. So you want to draw whatever your prescription is. Say if it's 20 units, you want to draw 20 units of air first. If it's 5 units, you want to draw 5 units of air first. You are going to take off the top, exposing the needle. You are then going to put the needle in at a 90-degree angle into the rubber, like so. You are going to flip it up so you can withdraw the medication. You are going to inject the air into the vial and then pull back on the plunger to withdraw the medication. So if I have 20 units, I'm going to go to the number 20. Usually I go a little bit past so I can just kind of push some back in and get rid of all the air, maybe give it a little flick here if you got a little air in there, and then you're going to take the needle out, and now you're ready to inject. So typical injection sites, you have belly, you have the thigh. Some people like to go over here in the hip buttock area. You can also inject back of the arm, but it's kind of hard to do that by yourself. Belly is really the best spot as far as absorption rate, and it's usually the easiest to do, so that's typically what I recommend for most people. And what you're going to do is you are going to aim for an area sort of on the side of the belly here. You kind of want to avoid around 2 inches around the belly button, just because there's very fibrous tissue there, doesn't absorb well, it can cause more pain, so just avoid that area altogether. So you're going to aim for more this area of the belly, this area of the belly. Of course, you have your alcohol wipe to clean the area. You're going to give yourself a little pinch where you think you want to inject. So I'm going to pinch right here. I'm going to wipe this area off to get it nice and clean, nice and sterile. Then I'm going to take my needle, all right? Again, 90-degree angle. Just push the needle in. I'm going to slowly inject the medication. All right. Once the medication is fully injected, you're going to withdraw the needle and let go of your skin, and you are all done. And that's all there is to it.